Hi, my name is Joe Marais. I'm a consultant rhinologist, nasal plastic, and ENT surgeon. Well, in actual fact, when I was a teenager, I actually wanted to be a vet, but I loved animals so much that I couldn't bring myself to think about having to euthanize animals. So I decided perhaps a career in medicine was a better choice. And when I got to medical school, I loved it. It was fantastic. In terms of ENT, I've always liked working with my hands, and the idea of helping people to feel better by using my own hands appealed to me a lot. And I found ENT particularly interesting because the part of the body of the anatomy is probably more complex and interesting than anywhere else in the body. So I found that really interesting. And so just drifted into ENT as a specialty. And indeed it was absolutely fascinating. So I was very lucky in many ways. Well, it's really having patients come in after they've had treatment, saying how much better they feel, how their lives have changed, how things have improved for them, and how happy they are that they've undertaken the treatment, because obviously all patients are quite nervous about having treatments done. And when they come back and they have a huge sense of relief and they're delighted that they've undertaken the treatment that you've suggested, that gives you a great feeling of satisfaction. Well, I think really patients really like, from when I look at all the reviews that I have on my various sites, the thing that comes through the most really is the fact that they like clear, open, honest explanations of what's wrong with them and how it's going to be repaired. They like to know what's going to happen, what they can expect, what they can't expect. And they like to be included in the decision-making process. So it's always nice when you can offer people options and say, well, we can do this or we can do that, and they're included in the choice. So it's not just a doctor making decisions on behalf of a patient, but it's them involved in their own healthcare. And I think patients really enjoy that and indeed appreciate that these days. In terms of what I like from patients is it's very nice and helpful for me if a patient comes with a specific complaint about something particular that bothers them, and they can be very specific about it, and it's easier then to get to the crux of the problem and solve it, rather than lots of nebulous airy fairy fuzzy sort of complaints which are very difficult to untangle and decipher.